Hello, I'm Jacinta Goda. Welcome to our conversations with the 2020 winners of the Robert Wood Johnson Foundation Award for Health Equity. In our conversations, the award winners share their stories and discuss the important work of systems change. I think you'll find their stories to be informative, insightful, and inspiring. Today, our conversation is with Dr. Maurice Lee. Maurice is the founder of the Arizona Safety Net. Let's learn more. Maurice, congratulations on your award. Let's talk a bit about closing systems gaps to achieve health equity. Now, you saw opportunities to close these gaps and you formed the Arizona Safety Net. Tell us a little bit more about that.
It goes way back. So back when I was in residency and running a free clinic out of a YMCA, and I was a resident at the time and thought I could do anything because that's what residents do, right? And we were seeing patients, really treating about everything that we could, but every once in a while we get stuck where we really needed either a specialist to give us the next step of what we can do, or maybe start something and then have us take over again. So I actually just reached out to every single clinic that offered care to the uninsured, whether it was on a case-by-case basis or that's what they were there for, and really got their buy-in, got to see what resources they had, what resources they didn't have. And then we kind of put a directory together on what clinics had what so that we could all start referring within each other.
Maurice, let's stay with this a little longer and talk about the making of the safety net and making those critical connections between primary and specialty care.
What I really tried to do in the beginning was try to paint a picture that when it comes to uninsured patients, we're all the same clinic. So they're going to all of our clinics, they're seeing all of us. Why not coordinate that care and make it the best that we can? So it took a lot of individual meetings. And then after about 5 or 6 months of meeting with all the different people, we finally met up. I think it was in October of 2015 as one group. And we're able to discuss what it would look like if every primary care was sharing all of the different specialty services that they had, and to get that coordinated.
Maurice, it sounds like painting the big picture is important, as well as building trust and connecting through shared values. Let's turn our attention to the physicians on the front line. When we spoke earlier, you explained how systems gaps can be frustrating for physicians and even lead to burnout. Help us to better understand this impact on physicians.
There is a lot of burnout and a lot of frustrations that people have. And unfortunately, the patient ends up getting labeled in a lot of the cases. So, I've heard a lot of physicians within the safety net say, yeah, we just wish we had this, but we don't have it. And I'm like, it's right here. Just do the referral and we can get it done, or let me know and we can start recruiting the right people for it. So it's really a win-win. People talk about the triple aim, which is, cost, quality, and patient satisfaction. But I really think it anchors not just the physician, but if you have a happy office that really loves what they're doing and they get a lot of just chicken soup for the soul when they go to work, they're going to be a lot more willing to take the extra steps and help the patients, as opposed to labeling them as non-compliant or other issues that we see in medicine.
Thank you for these important insights. You bring such a commitment to the communities you serve, especially those who are uninsured. What drives you in this direction to bring about systems change?
This is the only work that I've ever really wanted to go into. I've never really wanted to do anything else. And I'm not saying medicine. I'm saying working with people that are kind of, the underdog. They're down. I wouldn't say they're down and out. That's a really weird way of saying it. They just don't have someone out there being their cheerleader, being their advocate.
Let's talk about outcomes. The Arizona Safety Net for sure has made a difference.
What I can say is that the Safety Net now has between 40 and 55 individual clinics that encompass about 11 different healthcare systems. And that's all within the Phoenix metro area. It's really had a big transformation in the type of care that the uninsured is getting. The care went from what I've seen people say, well, they're uninsured, this is the best we can do, to actually evidence-based care. In our clinic, we were able to see, like I said, the diabetes is one of the most common diagnoses, 1 out of every 5 visits. And I think the controlled A1Cs was at 92% of our population. The people living with hypertension, their blood pressure was 95% of the people with hypertension, their blood pressure was controlled. I believe it was 88% of people with women were up to date with their breast cancer screenings. It was in the very high 90s. It was actually 99.7% of our women for cervical cancer were up to date with that. Colon cancer screening, we're at 92.3%. So, and then all of our vaccines were between around 92 to 97%.
Maurice, as you well know, last year, COVID changed everything. Talk to us about how this impacted your work and the lives of your patients. Did you do anything differently?
Yeah. We completely changed everything. So when COVID came around, our population, we knew from the beginning that our population was going to be disproportionately affected. So we weren't the ones that were trying to say, oh, let's wait until someone makes us do this or that. Immediately we went to telehealth. We were able to partner through the National Association of Free Clinics and CVS to become a testing site for the uninsured. And since we had already built this community, we just shared it with the safety net. All of a sudden, we were in our tiny clinic, we were doing around 125 tests a day. So our clinic turned into a call center. We still had our medicine that we were doing mostly via telehealth, and we'd bring people in if we needed to. We brought them in for medicines, we brought them in for labs. But other than that, the clinic was being used as a staging center, and we were the one place where uninsured patients could go for COVID-19 testing. So it really transformed everything. Incredibly proud of what they were able to pull together for that.
Wow, you face these harsh realities head on. Can you tell us about any of these practices that have now become the norm?
I had my own thoughts that my social history is so robust. When I'm talking to patients, I know my patients, right? Everybody says that I know my patients. I really felt like I did. And I really felt like once the patient was in their home and I was a guest in that process, I felt like they were truly in the driver's seat there. So post-COVID, I still want to do virtual visits, even if the patient can come in.
Maurice, thank you for our conversation today. You have shared a lot, and we have certainly learned a lot. And as we bring our conversation to a close, are there any thoughts that you would like to leave us with?
If you can institutionalize whatever change that you're trying to make, so make it a part of the culture, make it a part of a contract, make it the way that the clinic runs. When you have your systems change, your institutionalization, your culture change, don't make it an uninsured thing. Make it a patient thing so that everybody is treated the same, as opposed to, well, our uninsured patients will treat this way. We didn't go from canoes to submarines overnight. That was a very incremental change. So my advice would be, or my lesson learned, I guess, would be that things are doable as long as you stick with it. Again, I'd like to thank you guys for recognizing that the work that people are doing out there. I guess it's hard work. It's fun work. But it is good to get recognition. I know a lot of people were very happy to hear that the work that they were doing here got recognized, and it is special. I think we really are doing the right thing here, so we should keep doing it.
On behalf of the Robert Wood Johnson Foundation, thank you for your belief in the dignity and rights of all patients, and congratulations on your award.
Thanks.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2020 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.